Tēnā tātou katoa, good evening. COVID cases jumped by more than 3,000 overnight, and all the other big COVID numbers are up too, turning the screws even tighter on a health system already under intense pressure. There were 11,548 new community cases. That's the highest number since early April. 710 people are in hospital, 21 more than yesterday, and again the highest in 3 months. 17 people are in ICU, that number is up 4. And 19 people were reported to have died with COVID, up 2 from yesterday.
So increased COVID numbers are piling weight onto a buckling health system. Just don't say it's in crisis. The Health Minister today refused to use the C word, even though leading GPs, surgeons, nurses, aged care workers and midwives all say the system is in crisis. And Andrew Little should admit it. Political reporter Amelia Wade has more.
Love for the residents. That's what Natalie Seymour says is keeping her staff going.
They've had enough. They're burnt out, they're tired, they're exhausted, they're sick. It's got to stop.
It's not just action she wants from the government, it's a word. One Andrew Little isn't saying.
He needs to recognise that nursing is in a crisis and the aged care sector is suffering.
I am acknowledging the very severe circumstances that they're under.
Newshub can reveal just how severe those circumstances are for aged care. Each time a patient is put at risk because of staffing shortages, nurses file a Section 31 notice with the Ministry of Health. In 2020, there were 260 notices of understaffing causing a safety risk. In 2021, there were 851. And in the first 6 months of this year alone, there have already been 987, more than the entirety of last year.
Andrew Little needs to acknowledge that the aged residential care sector is a sector in crisis.
It doesn't matter what we call it, it's about what you do that matters the most, and what we're doing is continuing that effort to recruit.
There's 1,200 vacancies across aged care. Warwick Dunn says that's a quarter of the workforce.
Acknowledging a crisis is a first step. By acknowledging it, then we can look at some short-term solutions and then we can look at the longer-term solutions.
It's not just aged care calling it a crisis. According to a survey of more than 900 doctors, 99% agreed there was a health workforce crisis. The authors then wrote to the minister's warning, "We are at risk of a catastrophic collapse of the workforce."
Why not call a crisis a crisis?
Because I've been called on to call a whole bunch of different things crises before. In the end, it's not the label you put on it, it's what you do about it.
The Health Minister is refusing to use the word crisis because to him, that would mean the health system is literally falling apart at the seams. But to the healthcare workers who are burnt out, stressed out and stretched far too thin, hearing Andrew Little say the word crisis would properly acknowledge the extraordinary pressure that they're under. Amelia Wade, Newshub.